Okay, kita start dulu lah. Kalau yang lambat join tu, boleh join afterwards lah. Okay. Good afternoon, everyone. Thank you for joining today's CNE talk. I'm Rakin. I'm Physio Raki, and today I'm going to talk about transfers and back care. Yeah. So let me share the screen. Okay. Boleh nampak?
Boleh.
Boleh, eh?
Nampak.
Okay, so today we're going to go through transfers and back care. So does anybody know what is transfer and what is back care? Any volunteer? Sesiapa tahu apa tu transfer? Mesti tahu.
You transfer patient without having back care card.
Yes, the proper technique and mechanics in order to transfer the patient. Tapi apa tu transfer? Actually, what is transfer? Kita cakap transferring, apa transfer?
Transfer patient from bed to chair and again from chair to bed, or lifting patient using a proper tools. I don't know what's that called. Yeah, something like that.
Is it necessarily tools atau you don't need tools ke macam mana?
No. What I mean is those who are bedridden, there's a type of machine that we use to lift up, but some we can still transfer from bed to chair and chair to bed.
Bed to chair, chair to
Without using tools.
Kalau those that is not bedridden, can we still do transfer?
You mean without using any kind of mechanical technique, is it?
Yeah.
Okay, that's a tricky one. Those who are bedridden, I don't think so.
Okay, actually we can. Okay, depending on our capabilities, it's called manual transfers lah. Those that we do transfer without any equipment or without any tools, we call it as manual transfers. Okay.
Okay, thank you, Dr.
Oh, welcome. So we'll start first. So today we're going to go through a few agendas. Okay, initially we're going to go through the introduction and statistics relating to nurses, maybe physiotherapy, and also in Malaysia lah, regarding transfers and back care and whatnot lah. And then secondly, we're going to go through what is patient handling, what is positioning, and what is transfers. What's the difference between all these three terms? Yeah, I'm pretty sure some of the nurses have gone through the nurse handbooks when they were training, and they've gone through these three words, these three terms lah: handling, positioning, and transfers. Okay, the third one is transfer types and techniques. What are the types of transfers that you can utilize, and what is the techniques that you have to use in order to do it safely? And the fourth one is back hazards involved. Okay, back hazards involved. So what are the hazards that you can come across when you're not using a proper technique when transferring? And also, lastly, what are the recommended routines that you can do for back care and maintenance as a healthcare worker to take care of your back? Okay, let's go through the introduction and statistics. So we'll start from this article by Abdul Rahman and his colleagues in 2021, which was last year. Musculoskeletal disorders, or in short form MSDs, are among the most commonly reported occupational related diseases. Okay, meaning that among all the diseases that you can get from any type of occupation, okay, the musculoskeletal disorders are amongst the most common ones lah. Low back pain is a major public health problem throughout the world. and the prevalence of low back pain appears to be even higher for nurses than for women that are in a similar age in the general population. Okay. Many back injuries are occupational in nature. Occupational back injury is clearly related to lifting and repeated activities. Persons in occupations that require lifting, such as nursing, are especially at risk. Okay, for example, they show here that like nursing, okay, where you have to do like repetitive movement, repetitive lifting of the patient, transferring here and there. That's where you get the majority of back pain or back injuries. So the common musculoskeletal symptoms, or MSS, for musculoskeletal disease or disorders are discomforts on the musculoskeletal, peripheral nervous, and neurovascular systems, and people with MSDs experience severe muscle pain that causes difficulties in movement or pain in several body parts. Okay, so among the symptoms that they will feel when they have back pain or back injury is relating to the musculoskeletal, the muscles and the bones. Peripheral nervous, meaning that the nerves that are going through your limbs, your hands, your leg. Okay, neurovascular systems. Okay, interaction between your nerves and your vascular system or your circulation system. And people with MSCs experience severe muscle pain. Terputus ke? Sorry, terputus ke?
Yes, terputus.
Okay. Internet punya ni tak bagus kot. Okay. Anyways, so just paraphrasing it. People with musculoskeletal symptoms, the common symptoms include they have discomfort in the muscles, the bones, and then the nervous system that are going through the limbs, the hand and legs, and then the nervous system that are going to the circulation system as well. And among the musculoskeletal diseases, they experience like severe muscle pain, okay, and causes difficulties in movement and pain in several body parts lah. Okay. In addition to individual burden of lower back pain, the socio-economic costs, example sickness, absence, and loss of productivity, are likewise alarmingly high, making the current situation in the healthcare industry a societal issue with far-reaching implications. Nurses were found to have a 6 times higher prevalence of back injuries in comparison to other health professionals. It would lead to an increase in work absenteeism and cause of occupational disabilities among them. So because of lower back pain, there is actually a higher, because of the task of repetitive movement and whatnot, especially in for nurses, they have a 6 times likely to get back injuries. Okay, and this leads to like increase in work absenteeism, meaning that they are not able to come to work. Okay, and also the cost for the treatment for the back injury lah. So in terms of the impact of low back pain on workers, a study involving 187 countries pointed out that it was the major cause of disability and absence from work. Okay, because of low back pain, so there's a study that's involving 187 countries, and they found that because of the impact of low back pain, it's the one of the major causes of absence from work and also disability. It was found that those who work more than 7 hours a day, okay, were at risk of low back pain compared to others. Okay, so if you are working more than 7 hours a day, you have a higher risk of getting lower back pain lah. It can be due to repetitive exposure to excessive work, such as lifting a heavy object, which leads to injury to the lower back region. Furthermore, sometimes they need to work a few hours more to cover their colleagues on emergency leave or when there is lack of manpower. So when there's lack of manpower or if they take EL because of their lower back pain, then their colleagues have to cover for them. Then the tendency for that colleague to get lower back pain is higher also. So it becomes like a negative feedback loop. Okay, any questions so far? No questions? Tak ada, eh? Okay, we shall proceed to the next agenda. Patient handling, positioning, and transfers. So a question to the nurses. Okay, the caregivers can answer, physio can answer also. But I want to target the nurses because this is for your CNE. Do you know the difference between handling, positioning, and transfers? What's the difference between these three terms? Anyone? Yes? Yes, you know the difference? Or we try the younger nurses. Madeline, do you know the difference between handling, positioning, and transfers?
Madeline tengah ada kerja tadi.
Oh, Madeline tengah ada kerja. Okay. Oh, nasib baik. Okay. Apa Apa nama yang kat SIS tu? Mas Ayu 13
Idayu.
Idayu. Idayu Idayu, tahu tak apa beza handling, positioning and transfers? Apa beza tiga term ni?
Okey. Boleh dengar saya tak?
Boleh.
Okey. Kalau handling ni maksudnya kita pegang patient lah, kot more to pegang patient. So selalunya yang boleh berjalan, yang dia boleh buat ADL dia, ataupun like dia punya independent tu tak tinggi sangat, so kita kena guide. Kalau positioning selalunya mostly for bedridden lah, which is kita yang kena buat positioning untuk bedridden, turning, macam tu lah. Transfers ni more to macam tadilah, bed to chair, chair to bed, wheelchair to bed, bed to wheelchair, macam tu lah kot.
Okay. Very good explanation. Okay, so we'll go through all these three terms. So, handling is the lifting, transferring, repositioning, transporting, or moving of an individual who is a patient in a covered healthcare facility. Okay, so this one is not khas kepada patient who is able to walk. Okay, this one is for any patient inside a covered healthcare facility. Termasuklah Adelove lah. Adelove is a healthcare facility. So as long as inside a healthcare facility, the moving or the how you hold the patient, where is your hand placement, or the technique that you're involved for transferring, lifting, repositioning, transporting, or moving, all this is called patient handling lah by Law Insider. So positioning a patient in a bed is important for maintaining alignment and preventing bed sores, pressure ulcer, foot drop, and contractures. Okay, among the reasons to position is to prevent all these three lah. All these four. Proper positioning is also vital for providing comfort for patients who are bedridden or have decreased mobility related to a medical condition or treatment. When positioning a patient in bed, supportive devices such as pillows, rolls, blankets, along with repositioning can aid in providing comfort and safety. So positioning ni basically is not just lifting up the patient. Sorry, it's not just like moving the patient up the bed. It's not just that. It's also how you position the pillows, okay, the supportive devices, the pillows, the blankets, okay, so that you can make the patient feel comfortable. And also we reduce the contraindication or the side effects of prolonged immobility lah. Too long on the bed, what can you get? You can get bed sore. So how you prevent it? We do proper positioning. Okay, we put pillows or we position the patient on the side lying so that it doesn't have consistent pressure on that specific spot. Then we look into today's topic, transferring. Okay, transfers are defined as moving a patient from one flat surface to another, such as a bed to a stretcher. By Doyle and Mapuchin. So continuing on to transfers, safe moving and handling requires physiotherapists to know the correct procedures for moving adults and children without causing injury to either themselves or the person they are supporting. Okay, it is not just for physiotherapists but also nurses. So the correct procedure, you need to know the correct procedure so that you're not going to cause harm when you're transferring the patient. Okay, not just for the patient but also yourself. Okay, we don't want to end up, the patient sangkut somewhere and then you both jatuh. Okay, very dangerous lah. So this also includes learning to use hoists and also other aids. Okay, we have a few techniques that involve using supportive aids lah to transfer a patient. So let's look at the types and techniques to transfer a patient. So firstly, we want to consider the safety. Okay, safety of the patient and safety of yourself. You want to check the room for any additional precautions. Okay, is the situation, suasana, everything, is it safe? Okay, there's no leaking in the floor, there's no wet, anything that can cause both you and the patient to fall and sleep. Okay, so you want to make sure that first. Introduce yourself to the patient, okay, especially if it's a new patient. Okay, confirm the patient's ID using the two patient identifiers, name and date of birth. This one is for hospital, but if it's like our setting like this, just make sure it's the correct patient lah. Listen and attend to patient cues. Okay, sometimes the patient will give cues, sometimes the patient is not ready. Okay, so we wait for them to be ready, then we can transfer. Ensure patient's privacy and dignity. Okay, make sure the patient's wearing pants, if they're just using diaper, or if they're naked, or anything like that. Make sure we're menghormati dia punya maruah lah. Okay, assess the ABCCS, suction, oxygen, safety. Okay, all this you want to check the breathing, the breathing, the oxygen level, everything. If the patient is stable, then mostly you will know lah from just observing. Okay, but the patient tend to have like dizziness after you shift them to sitting on the side of the bed from lying down, then best you check the SpO2 and maybe the PP also, just to make sure. Okay. Ensure the tubes attachments are properly placed prior to the procedure to prevent accidental removal. Okay, if they're using any CBD, okay, or if they have RAS tube or any tubing lah, maybe granula or anything, make sure that it's not tersangkut when you want to move them to one place to transfer. Okay, so position the tubing, position the tools accordingly lah. The CBD, then you have to cabut from the side rail and put on the pinggang punya seluar punya pinggang tu lah. Okay, the rubber there, so it's easier to move the patient. So a gait belt and wheelchair are required. Okay, gait belt not necessary if you don't have it. Okay, but wheelchair of course you need it lah. So if you want to move from bed to wheelchair. Okay, let's look at the general technique guides for transferring. Okay, there are 7 steps. Okay, number 1, ensure the clothing, including the footwear, are appropriate. Ensure all participants are aware of the task, including the order of specific tasks and end position of the patient. Okay, so at least you need to know that the patient understands what are you going to do for them lah. Okay, so this comes with communication with the patient. We want to tell them we want to move them or transfer them from this bed to that wheelchair. Okay, and how you're going to do it. So they need to understand also whether they are ready. Get the equipment ready and in order with required accessories. So get the wheelchair ready, or if it's on the toilet, make sure that the handrail is steady. Prepare the environment, clear the route and access ways are clear, move objects and the destination is ready. Prepare client, explain what will happen, what they are going to expect to do, ensure the clothing including footwear are appropriate again. Okay. Number 6, if it's more than one person transferring the patient, then you need to choose a lead caregiver lah, or a lead helper or lead person who's going to do the transfer countdown. Okay, that person is going to do the majority of the transfer. The second one is going to assist them and follow the counting cues. Okay, so countdown, very steady move prior to the task. So it's going to be a coordinated movement. So what are the types of transfers based on the level of assist? So we have a 1 person standing pivot, 2 person standing pivot, 1 person assist with transfer board, 2 person assist with transfer board, sit to stand, 2-man transfer if it's from the floor, and also mechanical or ceiling track. And the last one maybe doesn't apply to us, but it's good to know lah. So let's look at 1 person standing pivot. So this is applicable for patients who can bear weight on one or both legs, and the patient is cooperative and predictable lah, meaning that they are able to assist you during the movement. If the patient does not help you at all, this is not suitable lah. And the patient can sit with minimal support on the side of the bed. Okay, so they are able to balance at the side of the bed. You don't fall down at the back. Okay, so a gait belt may or may not be used. So I think this is one of the more common techniques that you're going to use when transferring the patient. So you can see from the picture, step 1, step 2, step 3, and step 4. For a 2-person standing pivot, this patient can assist with weight bearing but may be inconsistent. But this patient is cooperative and predictable. Okay, so this patient doesn't have any condition like Parkinson and whatnot that's not jittery and can cause harm. Okay, so we know how the patient is going to move, and the patient is able to give kerjasama lah yang kita masa kita nak transfer patient tu. But the patient is not able to utilize both of the leg properly, unable to apply full weight bearing lah. So that's why you need 2 person to assist, one at the front or one at the side. So a 2-person transfer with a gait belt, a standard, or a 2-person transfer with a slide board and a gait belt may be used. Okay, next, 1 person assist with transfer board. So we don't have a transfer board at our center, but it's good to understand here lah that transfer board is actually quite useful. So the patient is cooperative, follows directions, and has good trunk control. So if the patient has good trunk control, able to follow direction and cooperative, this is suitable lah. They can use their arms but cannot bear weight on both legs. So if their legs are very weak and they cannot stand, by right we should use a transfer board. Okay, but bear in mind they need to have strong arms and strong core muscles lah, able to balance on sitting. So then this transfer board is suitable lah. 2-person assist with transfer board. So this will come in a situation where the patient is cooperative, can follow directions, can use both their arms, but they cannot bear weight on both legs and does not have good trunk control. So this one, they will require another person at the back to assist for the trunk control. Otherwise, it's the same as just now lah. Then we look at sit to stand. Okay, this patient can actively participate with some ability to stand, is reliable and predictable. May require 2-person transfer if heavy, which we sometimes we will see, we will use this side to side method to transfer one arm underneath the axial or the armpit, the other arm is going to do the most work, which is at the waist, okay, holding onto the pants. Okay, that one is holding onto the pants. The one on the underneath the armpit is just to assist. So so this patient doesn't have any severe limb contractures or injuries where the movement is medically contraindicated, like spinal injury. Let's look at two-man transfer, which is from the floor. Okay, so the patient is on the floor and is unable to assist during transfer. So in this particular situation, it's best to have two people, one person from the position at the arms, another person position at the leg, so then they can carry them up from the floor and onto the wheelchair. So to note, if after a fall, ensure you check the vitals and any physical signs for trauma, wounds, fractures before transferring. Please avoid transfer if fracture or major wounds. Okay, just maintain that and wait for paramedics lah. Let's look at mechanical and sealing track. Okay, this one is advanced technology where they put like a track on the ceiling so then they can carry the patient over to the wheelchair. It's like the thing they use for the baby lah, like the dokong. The patient cannot reliably stand, it's unpredictable and is too heavy for a two-person transfer, then no choice, they have to use a track. So some hospitals have this, okay, especially for patients who are obese and very big. Okay, 2 or 3 people also find it difficult to transfer him. In the end, they have to use more advanced technology like a mechanical or sealing track lah, to avoid back pain. Let's look at some situational examples of transfers. Okay, so bed to wheelchair transfer, wheelchair to toilet, wheelchair to car passenger seat, and floor to wheelchair. So bed to wheelchair. Firstly, we want to sit up the patient. Okay, make sure the patient is positioned. First, we have to position and lock the wheelchair about 45 degrees off the bedside. Ensure it is at the patient's intact or stronger side lah. If the patient is stroke, make sure you position it when the patient is sitting on the side of the bed, the wheelchair is at the stronger side. Help the patient turn over onto his or her side facing you. Okay. Put an arm under the patient's upper back with your hand supporting the shoulder and put your other hand behind the knees. And swing the legs over to the edge of the bed, helping the patient to sit up using the leverage lah. So while you're using the leg as a leverage, you can prop the patient up at the side of the bed. Next, stand the patient up. Have the patient scoot to the edge of the bed. Okay, so it's easy for you to transfer. Put the arms around the patient, chest, and clasp your hands behind his or her back. Support the leg furthest from the wheelchair between your legs. Lean back and shift your weight and lift. Finally, sit the patient down. Have the patient pivot towards the chair. As you continue to hold on, always transfer towards the person's stronger side. Okay? As the patient bends towards you, bend your knees and lower the patient into the back of the chair. Okay? If can, try to command or give instruction to the patient to use their hands to feel for the armrest so that they can gauge where is the distance of the wheelchair so that they can actually know when to sit lah. So here I have a video that one of the events I did with Daniel, where we actually teach people how to transfer. Okay, this one is the bed to wheelchair. Okay, so let's look at the first maneuver, which is from the bed onto the wheelchair. So usually,
can you hear?
When we're doing that, the patient will be lying down like this, okay, which we call supine lying. Okay, so when you're ready to transfer, actually before we want to transfer from the bed to the wheelchair, we need to prepare a few things. Number one is to explain to the resident that we want to transfer him from the bed to the wheelchair. Second one is we need to get our equipment ready, okay, and ensure that the patient understands what we want to do. Okay, so hello, good morning. So today we want to move you from the bed to the wheelchair. Is that okay? So later I'll help you lie down on your side and then have you sit on the side of the bed, only then I'll carry you, okay, on the count of 3 lines. Okay? So we'll take a sturdy wheelchair. Okay. And then we position this wheelchair right beside it. Okay, the side of the wheelchair depends on which side he is stronger. Okay, let's say for example this side here is on the left side is stronger than the right. Okay, for example if he has stroke on the right side, so on the left side affecting the right side, or if he has a knee problem on the right side, okay, so we want to position it on the left side when he's sitting down. Okay, here. Vice versa, if he has weakness on the left side, then we want to put on the other side. Okay, it depends on the resident. Okay, and make sure it's above. Okay, so let's look at the first maneuver.
Oh, what happened?
Okay, let's say for example this side here is on the left side is stronger than the right. Okay, for example if he has stroke on the right side, so on the left side affecting the right side, or if he has a knee problem on the right side, okay, so we want to position it on the left side when he's sitting down. Okay, here. Vice versa, if he has weakness on the left side, then we want to put on the other side. Okay, it depends on the resident. Okay, and make sure
Sudah?
it's above around 90 to 70 degrees.
Oh, yeah, yeah.
Okay, ensure you lock
Betul
your
kau, ah?
sides so that the wheelchair doesn't move when you want to transfer, and the foot plate is lifted up. Okay, some wheelchairs they have a special feature where you can lift up the armrest. Okay, but this one cannot touch. Some of them you can lift up from here. Okay, sir, are you ready to
Sekejap, sekejap.
Jadi saya akan cek. Nak
release the?
saya akan cek apa yang nak cek dulu.
Okay. I'm going to bend your knee a bit. Okay. Next, you want to bend the opposite knee. Okay, so then you can leverage to turn on this side. Okay. Can I have your hand across your body? Okay. So this way, when he's turning, his hand doesn't go under the body. Okay, you don't want the hand to go under the body. So if it's on top here, it's safer lah. Okay. I'm going to turn you to this side. Yeah, you ready? Okay. When you're turning the patient, make sure that it's close to you. Okay, close. Come closer, everyone. No worry. Close to you. Okay. Make sure you don't turn all the way, else the head will hit the wheelchair or the patient might fall down after that. Okay. Just control the speed and like this lah. Okay. This one we call side line. Okay. Sir, now we're going to put you into sitting. Stay at the edge of the bed. Are you ready? Okay. So when you want to sit at the edge of the bed, one hand you want to bring underneath the knee of this leg, this left leg. The other hand want to carry across the shoulder. Okay, ready? 1, 2, 3. Oh, just like that. Okay, when you're turning, you're pushing this down or you're lifting up, so it's not too heavy. If you just carry it up like this, you're going to swing your back. Okay, that's the wrong technique. So if you want to carry it up, use this as a leverage. Make sure the patient is okay. Are you dizzy? No. Okay, make sure the leg is on the floor, stable. Okay, you can hold here if you want. Okay, you need to take a few seconds to sit and rest first. Okay, are you ready to go on the chair now? Good. Okay, next try to bring the chair a bit closer. Okay, and then from here, if he's able to hold you on your shoulder, it's better lah. Okay, so can I have you hold over my shoulder? Okay, and your other hand will be supporting his on his pants lah. Okay, and this leg will lock here, so it doesn't go open. Okay, we're going to go on that side. We're going to turn. 3, 2, 1. Okay. Alright. So when he's seated, then you make sure, are you comfortable? Any pain? Good. And then you lift up the leg. Okay. And then some stroke patient, sometimes they like to slide down. Okay, dangerous. So most of the wheelchairs, they have something like this, which you can use to tie them. And then you can lock it. Lock. There we go. Okay. Okay. Okay, so now we move on to the next situation, wheelchair to car, passenger seat. So number one, get the surface of the patient is moving to and the car seat as close as you can while still leaving enough room for the two of you to move. Second, the therapist or caregiver should stand inside the open door where the door meets the car. Okay, number three, angle the chair 45 to 90 degrees to the car. Lock the brakes of the wheelchair. The foot pedal should always be swung out of the way or raised completely. Move the armrest out of the way on the side where you are transferring. If the armrest can detach, that's better lah. Number four, assist the user while they move towards the edge of the wheelchair seat. After they get close to the edge of the seat, then they can go ahead and lean forward towards the caregiver. From this point, a stand pivot transfer or sliding bar transfer may be used when transferring the wheelchair into a car seat. Number six, stand close to the person you are lifting. While lifting, be sure to keep your back in neutral position, which means that your back must be arched normally and not stiff. Keep both your knees bent and with weight placed on both your feet equally. Number seven, use your arms to support the person and use your leg muscles as you lift the person. When you pivot the body by turning on one foot, do not twist your body. Remember to keep your shoulders relaxed, but not bent or hunched. If you need a lot of effort to transfer the patient, strap the transfer belt around the person's waist. Hold onto the belt as you do the transfer. If the user has weak knees, you will need to line up your knees with their knees in order to provide extra support while lifting. Caretaker should guide the individual to shift their bodies towards the open car door facing the caregiver. Once they are next to the car door, advise the user to bend their knees to allow caregiver to assist in getting the person into the vehicle. So for this type of technique, you need to have them buttocks first in the car, then the body, then lastly the legs. So here's a demo that I have also for transferring into the car. The second one is from wheelchair into the car. Okay, we don't have car here, so we use this one instead. Okay, so the car is a bit different than going onto the bed or onto the toilet. Okay, because the car they have like a hood here.
Yeah, right.
So you want to bring them using the leg first or anything, it will hit their head on the hood. Okay, so the car, we want to ensure the car is stationary, okay, some brake, and then also that patient is ready to go on the car, inside the car. So for example, this is the driving side, this is the passenger side. Okay, make sure the seat is brought back to have maximum leg room. Okay, and then the door is open maximum lah. So you come close to the car. Okay. Okay. Now, sir, today we are going to bring you from the wheelchair into the car. Yeah. Are you ready? Ready? Yeah. So this one we're going to lock. Okay. Remove the leg of the footrest. Okay. If there was a buckle, you remove the buckle lah. Okay. And go in. Okay, sir, we're going to go inside the car now. Huh? Are you ready? Okay, same like just now, we're going to lock the leg. Okay, in case the leg open. You don't want it to open. Okay, can you hold onto my shoulder again? Okay, in front. Count of 3, we're going to stand first, yeah? Okay. 3, 2, 1. Stand. Okay, turn around. Okay, from here, hand here because you don't want the head to hit the roof of the car. Okay, that's how you bend a bit lower until you on the chair. Good, very good. Okay. From here, we lift the leg off the floor into the car. One leg and one leg inside the car. And then we take the seat belt and we buckle. Yalah. Okay. Any dizziness? No. Very good. And move to the wheelchair. And then we close the door. Okay. The second one is. Next, we look at wheelchair to toilet transfer. So, how to do that? First, stand the patient up, lock the wheelchair, be sure the patient's feet are under his or her body. Okay, grasp the back of the belt or pants and lift. Then moving on to move the patient to the toilet, keep the person's weaker knees between your leg. Pivot the person around in front of the toilet. Always transfer towards the person's stronger side. Gently sit the patient down onto the toilet. Help the patient adjust his or her clothing. Never pull on the person's weaker arm or lift the person by the armpits. Lock the wheelchair. Be sure the person's feet are under his or her body. Grasp the back of a belt or pants and lift. Okay, so here's a demo for going to the toilet. Okay. There's many ways to actually transfer from the chair to the toilet. But if it's like this place where the toilet's a bit small, okay, this is one of the easier way lah. Just position it in front of the toilet, about on the side, not directly in front. Okay, have some space for you to actually walk a bit in. Walk. Oh yeah. Okay, so now I'm going to transfer you on from the wheelchair onto the toilet. Yeah, are you ready? Okay. So some toilets they have this thing. It's like a L-shaped handle. You can actually make use of it when you're standing up. You can actually have him hold onto it so it's stable lah. Just think for this. Okay, later when you're standing up, I want this hand to hold on to here. Are you able to do it? Okay, so this one I'm going to lock at this side. Same technique, holding on to my shoulder. This one. Okay, 3, 2, 1. Okay, hold. Very good. Turn, turn. Can hold on to this side. Good, and down. Yes. That. So utilize this one, and then also this side. Okay, when you want to bring back, hold. Same way. But this side you lock this side, This time you lock this leg. Okay, the other hand you can hold on also. 3, 2, 1. Okay, then your right hand hold on to this side. Good. And go down. Very good.
Oh, you hold the trousers.
Yes, hold the trousers. Because if you hold onto here or here, there's nerves coming here. Then you can actually injure the patient, especially if they're heavy. So if you're holding here, at least it will support them.
Okay.
Because the center of mass is here. The center of where they are heavy is here lah. Okay.
So even from the bed to chair is also same, right?
Bed to yes.
Oh, I didn't know. I just hold like that way.
Anyway, you're bringing up like heavy resident or heavy object, best to hold at the lowest point lah. Okay. Marker. Then bring from the side. Okay. Okay. All right, and the last one is floor to wheelchair transfer using two-person assist. Here you can see this GIF here, how they actually transfer in a person. Okay, so first, ensure the patient is not in any life danger or any major wounds or fractures before performing this maneuver. Number two, position and lock a wheelchair nearby to transfer the patient onto. Have one person positioned near the patient's head and prop up the patient into long sitting. Place the patient's arm across their chest and put your hand underneath the armpit and over the hands of the patient. Have the other helper to position near the legs to carry under the thigh and or calf region. And on the count of three, the person one will command to lift and place the patient securely on the wheelchair. Let's look at the video for that too. Hi sir, are you okay? Did you fall down? Yeah, are you okay? Are you busy? Okay. Sometimes if they're falling down, you check the vital sign, the blood pressure and whatnot. Okay, see if they're stable or not first. Okay, so if they're okay, everything's okay. Okay, sir, I'm going to bring you on the chair. I already put the chair in front of you here. So I'm going to ask my friends to help carry you up there. Yeah? You ready? Sorry, internet problem. Chair, make sure it's not moving around. Okay, so there's two methods to do this. First one is side to side up. So using your right, the hand closest to the shoulder here, and bring it. Then when have it sit a bit. Okay, and the other hand. I see one carry 3, 2, 1. Yep. Yeah. Oh, very light, huh? Okay, this is the first technique. Okay, after that you belt on the body. Okay, the second technique. Second technique, I'll be on the head side, will be on the feet side. Yeah? Can I have you cross your arm? Okay. I'm going to carry that up. Underneath the armpit, carry. 3, 2, 1. Okay. Slowly. Okay. Alright. Just like that. Okay. And then if he looks like he's not really comfortable, and we talk like this now. Yeah. Hand here. Hand here. Yeah. He's comfortable. Okay. Okay, let's look at the back hazards involved when doing all these transfers. So rates of musculoskeletal injuries from overexertion in healthcare occupations are among the highest of all U.S. industries. Data from the Bureau of Labor Statistics (BLS) show that in 2014, the rate of overexertion injuries average across all industries was 33 per 10,000 full-time workers. So 33 in 10,000 people in normal industries suffer back injuries. In comparison, for hospital workers, it was twice the average at 68 per 10,000 people, and the rate for nursing home workers was over 3 times the average. So about 107 workers out of 10,000 will suffer back pain, and then the rate for ambulance workers are over 5 times the average, 174 over 10,000 workers. The single greatest risk factor for overexertion injuries in healthcare worker is manual lifting, moving and repositioning of the patient, residents or clients, for example, manual patient handling, ICDC. Findings of a study among surgeons in Iran showed that the prevalence of musculoskeletal symptoms was high, which were in the knees at 48.7%, neck 45.8%, and lower back at 42.3%, and shoulders at 40.1%. However, in Malaysia, they did a research in Malaysia at a private medical center, and they found that the prevalence of lower back pain among them is supposed to be reported to be higher, the highest actually, at 21.4%, followed by shoulder pain at 14.6% and neck pain at 13.6%. The healthcare workers usually stand for hours and work in awkward posture. Their work involves relocating the patient or objects, repositioning the patient in beds, pushing or pulling trolleys and things, using computers for administrative works. After a long period of repetitive movements in performing those movements, they are at high risk to get lower back pain and upper extremity disorders. These findings are later supported by another study which clearly stated that work tasks of nurses that mainly include lifting heavy loads by transferring patients from or to beds daily cause them at high risk of developing musculoskeletal diseases. Age was found as a significant risk factor for MSDs, in which young and new workers were more susceptible to the risk. So this relationship is further supported by a study showing that prevalence of MSDs are highest within the first 5 years of working and was more prevalent among fresh graduate physiotherapists. It's not just physiotherapists, but nurses also apply during the first 5 years of working because they don't know the proper technique and the body is not adapted. So they will feel more back pain compared to a seasoned nurse worker. Nurses and physical therapists were more susceptible to lower back pain in that order than the other categories considered weak and career periods. Age, body mass index, and female gender were the most common reported individual risk factors. Occupational risk factors mainly include work-related activities requiring back bending and twisting, lifting and pulling objects, and manual patient handling. So all this movement of bending, twisting, lifting, pulling objects, and then you're doing manually, all this will contribute to low back pain for both nurses and physical therapists. So let's look at what you can do to prevent and care if you have back pain or you want to prevent back pain. So if you have back pain already, here are some of the initial pain management techniques that you can use to relax or to reduce your back pain. Number one, a short period of rest. Using the over-counter pain medication, application of ice, application of heat, and small adjustments to your posture. So a short period of rest. A short period of rest limited to 1 or 2 days in which strenuous activity is minimized and excess pressure is kept off the spine. So when you have a rest day, make sure you don't do a lot of strenuous activity during those days to give time for your spine to rest. Sitting in a reclined position with legs supported and elevated, such as in recliner or in bed supported by cushions, is typically a comfortable position that minimizes stress on the lower back. Over-the-counter pain medication, such as NSAIDs like ibuprofen, naproxen, and aspirin or acetaminophen, are used as a pain reliever lah. But I do not encourage using medication unless really painful lah, and it's diagnosed by the doctor. Popular brand names include Tylenol, Advil, and application of ice. Application of ice or cold pack to the lower back to decrease local inflammation, which often accompanies back pain as a response to injury. Ice is typically recommended within the first 48 hours of onset of pain. It is important to avoid direct application of ice to your skin to avoid ice burn lah. Okay, so if you have if you get back pain, for example, suddenly you're doing the patient and then you pull your back. Okay, the best thing to do actually is to apply ice within the first 48 hours. Dalam the first 48 jam sakit belakang tu, apply ice or tak cold pack. Okay, cover it in towel and place it at the place where you feel pain. Okay, that's the best thing you can do actually. Above 48 hours, then it's best to use hot actually, heat application, as it can help to relax the muscle, relieve the muscle spasm, and improve the blood circulation to the area. Other than that, you can also do small adjustments to your posture. You can apply ergonomics, okay, find ergonomical chairs to put pressure off your spine. So, how to prevent back pain? Okay, to reduce the risk of back pain, remember to do the following. Organize the steps in your head before you move. Okay, if you want to move the patient, organize what you're going to do first. Keep the patient close to you. Okay, when you holding the patient close to you, you're actually distributing the force throughout your body. If you're holding it arm's length away from you, you're using mostly your hand power, which will transmit to your lower back. Which that is the main cause of your lower back actually, because the poor technique of holding the patient. Maybe you feel the patient ada saliva, air liur dia terkeluar and you rasa macam gigit sikit, takut nak kena air liur tu, then you put them away a bit, actually you're putting stress to your spine. In that case, just use their towel or use their blanket to cover yourself so that the air liur tak kena you lah. But it's best to put them close to you so you can distribute the full force towards your body. Keep your knees bent and your back straight. Consider using a gait belt if you have. Get help when you need it. If you feel the patient is too heavy, get help for a 2-man transfer. Okay. And here are some of the, this is the exercise, exercise for back pain prevention. Occupational health workers are recommended to spread knowledge about the beneficial effects of regular exercise in minimizing the risk of low back pain occurrence. Okay, so it's actually recommended to know about the exercises to relieve your back pain, okay, and to avoid back pain. It is recommended for the Nursing Division, Ministry of Health of Malaysia, to design an effective intervention to improve the condition. Many studies have shown that combination of treatment and health education, as well as corrective back exercises, is effective in treating mild to moderate lower back pain. Okay, exercise is also key to preventing and curing back pain. So if you want to know what are the exercises, here are some of the common ones. If you heard cat and camel before, okay, you put you stand on your knees and hand, and you do like how a cat looks like a cat and camel. Okay, standing hamstring stretch. While you're standing, put your heel onto an elevated surface, and then you stretch your hamstring, and then you stretch forward towards your leg, to your foot, stretch your hamstrings. Pelvic tilt, while you're lying on your back, bend both your knees, and then try to tilt your pelvis forward and backwards. Quadruped arm leg rises, so it's like a Superman kind of exercise where you lift the alternate leg and hand lah. Partial curl, okay, it's like sit-ups tapi it's just halfway. Trunk rotation, where you bend both your legs while you're lying on your back, and then you turn the whole hip to your left and right. Piriformis stretch is when you do a L shape on using your leg across onto the other leg, and then you pull it towards your chest. And then double knee to chest, where you bend both legs and then you pull it towards your chest. All the stretches is best to hold 15 seconds 4 times lah. If it's a repetitive movement, then you do it for 10 times slowly lah. So here are my reference lists that I use. So any questions? Open to the floor.
Hakim.
Ah,
Thank you for your presentation.
Okay.
Just want to ask, okay, during transferring, is there any precaution we need to take care, certain type of condition?
Certain type of condition for you or for the patient?
For the patient.
For the
So
patient.
when you're in patient, yeah. Like example, like just now you say about spinal cord injury, right?
Yep.
Is there any other condition we need to take care, precaution?
Okay, definitely we don't want to do any manual transfers for patients who have spine-related conditions. Okay, if they have recent spinal surgery, also we don't want to do. Okay, unstable fractures of the spine you don't want to do, and spinal cord injuries you don't want to do also. Even if it's not complete or it's complete, regardless, we don't want to do manual transfers for patients with spine-related conditions. Aside from that, general fractures of the hand, leg, and whatnot, also we don't want to move. And if the patient has some sort of circulation problem and vertigo, okay, that one is precaution, okay, because if you move and position them from one position to another position, they might have what you call something like postural hypotension, okay, and that can lead to dizziness. So we don't want that, okay. And if it's dizzy and we try to have them to stand, then they lose balance, then you fall with the patient lah. And if it's like vertigo, if they have some sort of problem related to the nerves, to the inner ear, okay, it will cause vertigo or vertigo. So for that, we want to move the patient slowly lah, and let them be able to adapt each position, have time to adapt before you move them onto the chair. Does that answer your question?
Yeah, thank you.
Any other questions? Physio, you have any question? Ellen, Atira, any question? Tauki, any question? No question, huh?
Sorry, Rakin, one more. Sorry.
Can.
Okay. Since I just asked question again lah. Okay. Which one is more important? We have to take care. Like example, exercise is more important, or the ergonomics is more important for our staff, especially for the staff nurse, physio semua.
Okay. Speaking at the
more priority. Is whether ergonomics or what they call exercise, back exercise, everything on.
Okay, speaking from a health worker point of view, I feel exercise is more effective lah in preventing and also curing back pain. Okay, why? Okay, firstly, there's a research that says that they've run a trial or experiment on a private hospital for nurses over a 6 month period. And from there, they taught them how to do ergonomics education, okay, how to apply ergonomics. After 6 months, they found out that the results are pretty much the same. They still have back pain and whatnot. Okay, it's not really because of taking care of the posture, but it's because of the repetitive movements that is causing the pain, the bending and the twisting. Okay, it's not how they sit on the chair, but it's actually how they actually do the task that they have to do every day to move the patient. So that's the main contributing factor for lower back pain. So to answer your question, I feel that exercise is more important because it helps to maintain your muscle tone, okay, relax your muscles when you're doing stretching, and also strengthen your muscle so that you can cope for higher stress. So you don't put more stress on your lower back. So your muscles are supporting your core and your lower back.
Okay, thank you.
Any other questions? No? How about nurses? Nurses, do you have any question from the nurse side? Ezila, ada apa-apa soalan? Ezila, Razia. Tak ada, Razia ada soalan?
Tak ada.
Tak ada. Nati, ada soalan? I'm going through all the nurses.
Rakin,
Ha,
Rakin nak tanya,
okay.
ada tak spesifik tools kita boleh pakai untuk prevent kita punya back pain?
Okay, if you're talking about tools untuk prevent back pain, okay, one of the
Bukan
major
prevent
contributors.
lah,
Macam mana?
bila kita dah ada back pain, so macam mana kita nak ni, selain daripada kita ambil painkiller,
Okay.
maybe kita kena pakai something Del ke.
Okay. So once you already have the back pain, okay, but you're still working, you have shift to cover. How do you want to avoid getting even worse the pain, right? Aside from the medicine lah, medicine is one thing, but medicine always have the side effect, so it's not good to abuse the medicine lah. So aside from that, I can recommend braces or vests that you can use to support your lower back. Okay, if you have pain lah. Okay, that is one of the tools that they can use. They actually strap at your lower back and pull to the front. Okay, this one can actually help to release some of the stress on your lower back. Okay, it might feel a bit funny because it's a bit tebal, tapi it actually helps to reduce the stress on your lower back, and you find it that it will be less pain lah. Other tools that you can do is if the patient has a gait belt, make use of it lah. The gait belt is the one that they strap on the patient side, and then you have something to hold on to. So the gait belt is actually utilized to distribute the pressure outside your lower back actually. So you can use more on your hand and more on your leg. So that one takes off the stress from your back, especially for heavy patient. Apa lagi yang boleh kalau tak, you can use tools, supportive assistive tools like the transfer board. Okay, if you have a transfer board or you have time, you can look into transfer boards. This one is just have the patients lie onto the board. Okay, this one doesn't require any lifting at all. Once the patient is sitting on the bed, just have the patient just slowly use their hand to slide across the board. You can have 2 people to assist or even 1 person if the patient is able to use their hand. So actually transfer board is really good to put the stress off your back. Did I answer your question?
Okay, yeah.
Okay. Okay. Anybody else? Kak Sophia, Atika, any question? Ada. If no question, I think we can end today's CNE lah. Okay, thank you for joining. Kak Mas, sister, dah ambil attendance kan? Untuk Sungai Long?
Ya, dah.
Dah okay, so we can end lah. Okay, thank you everyone. Uncle Long nak tanya, jangan. Okay, thank you. Bye bye.
Thank you.